In this brief discussion we will discuss how the inability of certain demographic groups to access gender-affirming care affects the healthcare system. Key points include the importance of gender-affirming care, the impact on mental health, disparities in healthcare access, historical perspectives, influential advocates in the field, and potential future developments. Gender-affirming care is a vital component of healthcare for transgender and non-binary individuals. It encompasses a variety of medical interventions designed to align an individual's physical appearance with their gender identity. These may include hormone therapy, surgeries, and other related services. The inability to access such care can have profound effects on individuals' health and well-being, as well as on the healthcare system itself. Let's explore these dimensions in detail. Access to gender-affirming care is not merely a health issue but also a matter of human rights. The World Professional Association for Transgender Health emphasizes the significance of adequate care in reducing the risks of mental health issues among transgender individuals. Research indicates that those who receive gender-affirming care are less likely to experience depression and anxiety. This trend underlines the necessity of not only making these services available but also ensuring that they are accessible and sensitive to the needs of different communities. One of the most immediate impacts of limited access to gender-affirming care involves mental health issues. A study published in the American Journal of Psychiatry notes a significant correlation between access to gender-affirming healthcare and decreased suicide rates among transgender individuals. When certain groups cannot obtain this care, their risk for mental health challenges, including depression, anxiety, and suicidal ideation, increases. This creates a cycle of distress that can lead to significant strain on mental health services within the healthcare system. Moreover, disparities in healthcare access further complicate the health outcomes for marginalized groups. Geographic, socioeconomic, and racial factors often play a role in who can obtain gender-affirming care. Rural areas tend to have fewer healthcare providers specializing in this field, which forces individuals in those regions to travel long distances or forego care altogether. Additionally, systemic racism may affect access for people of color, who may already face barriers in the healthcare system. The intersectionality of various discriminatory factors leads to even worse health outcomes for those in marginalized groups. Influential individuals have played critical roles in advocating for gender-affirming care and awareness. For instance, transgender activists such as Marsha P. Johnson and Sylvia Rivera fought for the rights of transgender individuals during the Stonewall era, laying the groundwork for modern advocacy. Today, organizations like the Human Rights Campaign and Lambda Legal continue to champion equal access to healthcare for transgender individuals, providing resources and support in the fight against discriminatory practices. The courage and resilience of these advocates have influenced public policy and created pathways for expanded awareness of gender-affirming care. Different perspectives on gender-affirming care create a complex landscape in healthcare. For some, especially within conservative circles, gender-affirming procedures are viewed with skepticism. Critics may argue that such interventions can have harmful effects or may be pursued by individuals who are not fully informed. However, this perspective often overlooks a robust body of research demonstrating that when provided with adequate information and support, patients can make informed decisions about their bodies and health. The medical community largely supports the need for such care as essential for mental health and overall well-being. Future prospects for gender-affirming care are closely tied to ongoing legislative and societal changes. Recent developments show both progress and regression in terms of access. Some states have enacted laws to protect and expand access to gender-affirming care, while others have introduced legislation that may restrict this access. The political climate plays a significant role in determining how healthcare policies unfold. Advocacy efforts will be crucial in shaping future healthcare landscapes to ensure that all individuals have the opportunity to access necessary gender-affirming care without bureaucratic or societal barriers. The economic implications of restricted access to gender-affirming care also deserve consideration. When individuals do not receive appropriate care, they may face higher overall healthcare costs due to the need for crisis interventions, emergency room visits for mental health issues, and other reactive healthcare approaches. Insufficient preventive care can lead to a greater financial burden on the healthcare system. Studies reveal that investing in gender-affirming care can yield long-term savings by reducing the need for more intensive and costly healthcare services. The integration of gender-affirming care into standard healthcare practices is essential. Medical professionals must be trained to offer inclusive and competent services that respect the varied identities of their patients. This requires a shift in how medical education approaches gender and health, ensuring that future healthcare providers understand the unique needs of transgender and non-binary patients. Continued education and training are essential to equip providers with the tools necessary for offering informed, respectful, and effective care. Moreover, mainstreaming gender-affirming care could catalyze a broader cultural shift towards acceptance and understanding of gender diversity. By normalizing discussions around gender identity and expression within healthcare providers, patients may feel more empowered to seek care without stigma or fear of discrimination. This ultimately benefits not only individual patients but also the healthcare system as a whole by fostering a culture of inclusion and understanding. Collaboration among stakeholders will be vital in fostering an inclusive healthcare system that prioritizes the needs of transgender and non-binary individuals. Policymakers, healthcare providers, and advocacy groups must work in concert to address legislative barriers and ensure funding for gender-affirming services. Engaging communities in advocacy efforts can amplify voices that have been historically marginalized, laying the groundwork for lasting change. The future development of telehealth services also presents an opportunity to expand access to gender-affirming care. Telehealth can mitigate geographic barriers by connecting individuals in rural or underserved areas with specialized providers. This option may ease access for groups traditionally excluded from healthcare due to location or transportation issues. As technology continues to advance, the potential for telehealth services to enhance accessibility becomes increasingly apparent. In conclusion, the healthcare system faces significant challenges when certain groups are unable to access gender-affirming care. From serious mental health implications to systemic disparities in access, the effects ripple through both individual lives and broader healthcare frameworks. Historical advocacy has laid a foundation for continued progress, though substantial work remains. Diverse perspectives must be acknowledged and addressed to create a more inclusive healthcare environment, ultimately leading to better health outcomes for all individuals. The future shines with potential developments, but they will require cooperation, education, and a commitment to equity in healthcare. 10 down WJ, E, N, T.